We all had friends in our early childhood that we hope we could stay with them forever. Some of the friends had played significant roles in our lives that imagining their absence will totally remove meaning out of life. Unfortunately for me, I lost my best friend in 2015 when she failed to access basic healthcare services simply because our village was 4 kilometers away from the nearest hospital. That whole process posed a lot of questions and ushered me to ask, why can't we have accessible healthcare services? It is through asking the why that I was able to come up with the idea to start PrimeTel. PrimeTel is an incoming telehealth application that seeks to use the latest telemedical advancement technologies in order to provide access to diagnostic, prescriptive, and consultative healthcare services, particularly for people in rural areas. Our mission is to radiate access to untethered diagnostic, prescriptive, and consultative services to all corners of Tanzania, irrespective of people's income levels, even cultural orientation, by the year 2035. Our vision is life, because we believe that people's life matters and we need to do all it takes to ensure that we retain their lives. PrimeTel seeks to start its operations in Arusha, Tanzania. And while we are amidst designing our USSD-based application, as a company we have already designed our online application that have been piloted, and we have been able to learn a lot from the field testing that we believe the experience will then trickle down to the USSD application that we are designing. I am here at this conference not just to ask for financial support to actually launch this project. I'm here to show you why you should care about the fastest growing telehealth field, why you should be involved in providing access to untethered digital health services for people in rural areas. Despite progressive measures by the government of Tanzania, less is achieved in providing universal healthcare coverage for people in Tanzania. To this date, individuals spend up to 15% of their disposable income to access basic healthcare services. This is not to mention that the doctors to patient ratio is actually not matching, where as of now we have 1:25,000 as opposed to the recommended 1:10,000. Additionally, only 37% of the population have access to medical insurance, which of course further exacerbate the existing coverage of public healthcare sector, where only 53% of the population is actually covered by the public healthcare service providers. My solution is unique in many ways, given that it is accessible online and offline, and it's actually remote, where people do not need to travel hundreds of kilometers to reach to the hospital, and they can just access basic healthcare services at the convenience of their fingertips. How it works for the online application is that we have an onboarding process where individuals will create an account with PrimeTel, and therefore they will be able to get the doctors that match their medical needs, and from there they can pay for a compassionate subscription plan, which will then unlock an array of interesting services that we offer as a company. Additionally, the offline model simply works with feature phones, where individuals do not need necessarily to have access to internet connectivity, and they can access the basic healthcare services they need irrespective of their financial or network status. The impact that PrimeTel seeks to bring on board is to basically improve access to basic healthcare services, and we seek to do so by combining the effort of private and public players within the healthcare sector in our own very application. Additionally, PrimeTel application has been gone through robust testing, field testing, where we have been able to raise critical feedback that is currently informing the design of the incoming offline application model. We believe with these particular models, we will be able to provide untethered access to basic healthcare services and basically mitigate loss of life that we have been able to experience as a result of the existing conventional healthcare service system. PrimeTel startup is not one without competitors. Over the past 5 years, Tanzania's telehealth medical landscape have actually increased and expanded rapidly. There are several companies that have already ventured into providing Tanzanians with digital health solutions. Nonetheless, most of the companies have primarily been based on medical tourism and squarely leaning towards mental health. PrimeTel, on the other hand, seeks to bridge the gap that exists in basic healthcare services through targeting people with urgent medical conditions. I am here to request $5,000, an amount that will go into fully establishing PrimeTel. Last year, we got over $5,500, an amount that have gone into covering the setup cost, where we have been able to not only construct the online application, but also begin the critical steps towards establishing our USSD-based application. As a profit-oriented company, we are bringing forth a compassionate subscription plan through which individuals from any area in Tanzania could opt for. The $5,000 that I am requesting today will go a long way towards establishing robust marketing campaigns that will bring this whole concept to public awareness. It will also go into staffing. PrimeTel currently needs technical and computer-oriented individuals. We also need medical doctors who will be able to carry the consultations. With the current financial abilities, we are unable to meet those financial obligations. We seek to leverage various distribution channels such as our own website. We also seek to venture into our application to use it as a marketing alternative. We also seek to partner with other medical institutions within the country to bring the platform to awareness. Speaking about the overall revenue stream, we will be mainly focusing on the overall subscription fees that are brought by our paying customers. Looking at PrimeTel financially in the next 6 years, we will be breaking even. Given that our initial projections indicates that with the $5,000 that we are able to raise from our investors today, we will only need around 1,000 early users from now to 6 months to be able to break even at a subscription fee that is widely reflective of the financial scenarios that individuals are within. Within 1 year, PrimeTel will fully be autonomous, and it will be an independently running startup that is able to meet its financial obligation as well as expand to even other regions within the country aside from Arusha. PrimeTel's registration conversations with Tanzania's Ministry of Health have already commenced, and we hope to register PrimeTel this summer. PrimeTel is made of a team of experienced individuals. So far we have 3 doctors on board, and we have 1 software developer whom we are working together to put the online and the offline application and to make them operational. Furthermore, there are various stakeholders that we seek to bring aboard as we radiate this solution. We seek to bring together public and private healthcare facilities within the country. We also seek to leverage the support from existing NGOs that advance key healthcare agendas. This is also not to mention that given we are dealing with a USSD application, we seek to integrate telecommunications company to help us reach to the rural areas within the country where we are needed most. PrimeTel's strategic plan towards becoming a well-established telehealth application is already made. In the next 10 years, we seek to transition from relying on grants to being fully financially independent through the financing models that we have. We already have thought of options to avail equity for the various individuals willing to partake in this struggle. Overall, our approach is to ensure that healthcare service is not a privilege, but a right that everyone can access. With regards to uncertainty, PrimeTel already have various strategic plans to cover for that. We seek first of all to maximize our own financial stability to be able to address any unforeseen occurrence that might interfere with our operations. I am here again to ask for the 5,000 US dollars. I believe this investment will go in the books of history as it supports a noble and a novel call of providing access to basic healthcare services